Hi everybody, it's Tracy again. Welcome to week 3. I'm looking forward to reading your week 2 papers about the health histories. Now this week's objectives revolve around total health assessment, physical assessment, and how findings from these two things can help with patient education. So let's look at the first DQ question. It's about finding signs of cutting during an assessment, so that depending on your setting, that may or may not be unusual. There are a variety of ways that this could be handled, this situation, and it does require the nurse to have some up-to-date information about cutting and what it may indicate and that sort of thing. So I look forward to hearing how you would handle this situation. In the second discussion question, we are again now working with a nursing student, and we need to provide some feedback. So take a look at that assessment or that scenario. It's a little bit different because the student's initial reaction is posted there, and then you'll need to respond to it. And so I'm looking forward to see what approach you would take with this particular situation. So we do have a paper due this week, and it's only 750 to 1,000 words, so not too bad. And it deals with the last time that you had a physical exam yourself. Okay, so it can be an annual exam, a GYN exam, a problem-focused visit, any of those. The visit needs to be with a doctor or a nurse practitioner or a PA, can be any of those. And so basically in this paper, you're going to be recalling your experience as a patient and using that to basically critique your visit. Okay? And as we critique the visit, we also bring to mind things that can be quite important in health assessment to our patients. Please take a look at the rubric for the assignment in addition to the directions, because there's some few things in there I think you should be aware of. And the paper will be written as a normal narrative paragraph format, just regular old paper, but you do need to include at least one reference. And that may have to do with when you're critiquing the adequacy of the actual physical exam. Maybe you want to throw in something there. You can throw in something about the environment, whatever you want, but there just has to be at least one reference that you're going to be citing. Okay, so please let me know if you have any questions about that assignment. And I hope that you're kind of getting into the swing of the course. For me, I can't believe that we are already at week 3. It's kind of buzzing by, so I did want to give you just a reminder that in week 4 and the last week of the course, in both of those, there are CLC assignments that are going to be due. And the 4 of you, of course, are the one CLC group. So you may want to start brainstorming about your topics in the near future. So the first assignment in week 4 requires you to critique health education material, like a brochure or some type of written material designed to educate the public. And then the last assignment in week 8 is going to be about exploring a health risk assessment tool. And you're going to answer quite a few questions about these and dig in a little bit. The last one, you're going to pull from some of your nursing research knowledge. So it's going to take a little while to coordinate and produce a good product. So the sooner that you guys choose your focus areas for each project, then each of you will be able to search for information as you have time during the week. So just some food for thought. All right, so I think it's about it right now. I'm recording this on Wednesday, and so I'm going to start reading your papers Thursday night, Friday, and Saturday. I'm hoping to have all of them done by Saturday night at the latest. You never know what might come up, but that's my goal right now because I do want to give you that feedback before you have to turn in your next assignment. So, all right, guys, I'm enjoying spending time with you, and I'll see you in the main forum.